All right. Howdy, folks. Welcome back. I'm happy to be joined tonight by Denise Rose and Georgie Campos of the Happy Vegan Couple. And just to remind you, I'm Stephanie Spencer. I'm a former cardiac RN of 27 years turned plant-based educator. And tonight we're both promoting products that we have in the 2024 Vegan Health Bundle. This is 150 contributions that worth over $8,000 that you get for $49. And we're going to talk about our 2 contributions in addition to the other 148 contributions. So what I have to offer is my You're as Old as Your Arteries course, which has a whole lot of information, really everything you need to know about heart disease that you are not going to hear in the mainstream medical field. I worked in cardiology for my entire adult life. I used to run a heart failure clinic for 17 years, and all of my patients just about were diabetic, and all of them had already had a heart attack and now had heart failure. So it was really clear to me when I started learning about plant-based nutrition, everything that we don't do in the medical field, and that's what I'm going to talk about tonight. And then Denise and Georgie are going to talk about their offering in the bundle, but I'm going to go ahead and turn it over. Denise and Georgie, y'all want to introduce yourselves?
Sure. Well, we'll start out
jump in
on our YouTube channel just for the fun of it. I'm Denise.
I'm Georgie.
And we're also known as the Happy Vegan Couple. So that's our little introduction. And the main reason we joined the bundle is we just want people to know about our YouTube channel, because we're not the real famous ones, and we don't do 1,000 videos like, in a couple months. But what we have on there are wonderful cooking videos with him doing most of the cooking with step-by-step instructions to give anybody who's not confident in the kitchen confidence by watching him. Mm-hmm. So they're really informative. I've cooked a couple times, but he's mostly the guy. And then I've also done some wonderful, long, in-depth interviews with people who actually had a major health transformation when they went whole food plant-based. They lost massive amounts of weight, and their other health conditions got so much better. I have that on the channel. So we just love to teach. I do mostly the science and the whole food tips about how to eat this way, and he shows people how to cook. And I just want to share this, why we wanted to connect with Stephanie. So when I looked at the bundle, because we got the bundle in advance of everybody, and I got to tell you, it's amazing. There's so much content there. It's overwhelming because it's amazing. But I looked at her content, and I was really excited that somebody like Stephanie had this, heart information knowledge in there. And the reason is that the whole reason I got into this was because of my father's heart disease. And so my father, around age 50, had his first heart attack, and then the heart disease kept developing until he died, at 81. And by that time, he had a couple bypasses, a valve replacement, and then he had died of congestive heart failure along with Parkinson's. And it was a horrible life in my family with all the anxiety, the emotion, and the stress of the heart disease. Well, guess what? In 2012, I find out that my father's heart disease could have been halted. He would have stopped putting plaque in his arteries, and it might have even dissolved if my father would have done a fundamental diet change. And that's what I learned about in this great documentary called Forks Over Knives, and of course I know Stephanie knows about. And I watched that when I was 60 years old, which was about 12 years ago. I'm going to be 72 in May.
Wow. You could have fooled me.
But anyways, what I learned in that movie, Forks Over Knives, was what I just told you, that my father did not have to suffer, or most likely did not have to suffer. Nothing works 100%, right? But if my father would have changed to a whole food plant-based diet that was low in fat and followed the research studies of Dr. Caldwell Esselstyn or Dr. Dean Ornish, who did studies with really sick people with heart disease and found they could actually have some of that plaque go away, I could have told my parents that. They could have done that and our life could have been different. But did a doctor tell them that? No. I know all my mother got, Stephanie, was don't give Bernie red meat.
Yep.
Right? Stop the red meat.
Stop smoking, exercise, and don't eat red meat. That's what they'll say.
And my dad never smoked. He didn't drink much. And he was actually afraid to exercise after the first heart attack. He was scared to death to exercise. And so I'm like, no doctor tells them this knowledge of what's in the medical literature. Well, that was my catalyst. I decided when I learned that knowledge, I said, this is wrong. The doctors aren't sharing this. And the doctors don't learn this. That's the problem. They don't teach this.
They don't know. It's not that they have perfect knowledge and they're withholding it. They do not know. Yeah.
Right. So I like to research. I have a PhD in sociology. I like research. I love to teach, educate. That's really my thing. And so I said, I'm going to learn this knowledge and I'm going to teach it and share it. And that's what we do. And I love to teach. And if anybody watching has a group and they want a presentation, I'll be there. And I don't almost never charge. I just want to share information and help people not have chronic disease. So that's our thing. So after Stephanie does her little bit, she's going to talk about heart disease. We're just going to tell you, we're going to talk about our bundle contribution, which is kind of on the counter here, which is a wonderful Mexican meal. And we created a video course with I think 6 new videos on how to make all these elements of the meal and all the recipes and all that. So that's our bundle contribution, which is going to be quite delicious. But I'll turn it back over to you, Stephanie, and go ahead and share.
Excellent. Well, I'm super excited. Mexican is one of my favorite foods to eat. And it's really the easiest way to transition over is just eat Mexican food without.
Absolutely.
Yeah. All right. Well, let me go ahead and share my screen here. All right. Come on. Oh, please. There we go. There's always that. There we go. It worked. Okay. All right. So what I want to talk about today, and if you're already whole food plant-based, we're just preaching to the choir, but I really like to talk to folks that question a whole food plant-based diet. Because like Denise was saying, in the regular medical field, your doctor's going to tell you all day long, it's fine to eat meat and, like chicken and fish and low fat dairy, just avoid the red meat. But, and people that's what they want to hear. And so they don't realize the benefit of doing a more substantial change. So what I want to talk about is, when do we need to start worrying about heart disease? Is it only old people that get heart disease? And that's kind of what we tend to think, that you're usually at an advanced age and heart disease just comes out of the blue. It's like a lightning bolt, and you have this bump in your coronary artery that the doctor finds while you're having a heart cath, and then they'll put a stent in, and then that's problem solved, right? Well, not so much. And we're going to talk about why it's not problem solved. So look at this is a coronary artery. And it's that's those big arteries that are laying on the outside of the heart. Those are the ones that get clogged up or get a thrombus, a clot in them, and cause the heart attacks. And so this clearly looks awful, right? It's all filled up with cholesterol with just a tiny pinhole. But a lot of people think well, it's got to take until you're 60 or 70 to get that much cholesterol to clog up your artery. So when do I need to really start worrying about heart disease? Well, they've done quite a few studies on when do we actually need to start worrying. So when we're born, this is what a cross section of our coronary arteries looks like. It's just nice and clear and open, right? But they actually did a study, I think it was in the 80s or so, on autopsies of children who had unfortunately died in accidents. And these were children that were as young as 10 years old. And you know what they found out? They found that on their abdominal aorta, which is the big artery that goes up to our heart, that they had fatty streaks, like a little line of chicken fat lining that abdominal aorta. And how many do you think had this fatty streak? Was it just the kids whose parents, were really bad parents and gave them gas station food? Nope. 100% of all of these children autopsied at a young age had fatty streaks in their abdominal aorta just from eating the standard American diet. And then there's another study done in the Korean War in 1953, GIs on autopsy, GIs are going to be 18 to 22. They found that 77% of them had what looks like this, gross evidence, like we could see heart disease with the eye, and they're young and healthy at that. And this was like back in the 50s before the diet wasn't as horrible as it is now. And by the time we get to be older, like in our 60s, the average American eats 65 pounds of fat per year and consumes about 2 tons of fat by age 60. That's enough to fill up the back of a pickup truck. So yeah, it's really shocking about how we don't realize how early we have plaque buildup in our arteries. We have coronary artery disease visible to the human eye decades before we start to have symptoms. Okay. So, but here's the underlying assumption we need to address. Is the real cause of heart attacks the fact that our arteries just fill up with this sludge, and then eventually one day that little pinhole closes off? Is that the primary way that heart attacks happen? Well, and that's what we typically tend to think. I was with my mom at the doctor a few years ago, and they remarked she had had a heart cath, and they said, "Oh, you've got a 50% blockage, and like your LAD or something." And she was like, "Oh, is that a problem?" They said, "No, because you're 80." They said it took 80 years to fill up to 50%. So we'll take another 80 years to fill up the whole way. So everything's fine. But luckily she switched to a whole food plant-based diet, and now her total cholesterol is 129. So we don't have to worry about it. But so actually, in reality, this is what I call the clogged pipe theory. And this is what a lot of doctors operate off of, that the cause of heart attacks is just the slow sludge building up over time, and then it finally closes off. But in reality, that is only 10% of heart attacks that happen that way. The vast majority, 90%, are actually a rupture from a smaller unstable plaque. And that's probably what happened with your father, Denise, at age 50, like no symptoms at all. And then you just have a big heart attack. Okay. And so this, and I hope you can see my cursor, I think it'll show up. This is a typical, what we call a small unstable plaque. And this little bump here, it's just a cholesterol plaque from all the animal products, the eggs, the meat, the fish, the chicken. Chicken is just a little bit less fat than red meat. You're still going to get plenty of cholesterol that's going to burrow down in those LDL particles, low density lipoprotein. That's the bad cholesterol. That's going to burrow under this lining and create a cholesterol plaque. So this white line here is called the endothelium. That's a really important word to remember, but that's what determines the health of our arteries. If our endothelium is healthy and thick, even if you have a calcified plaque, it won't allow a rupture because it's so thick and protective. But when we eat inflammatory food, and meat and dairy are very inflammatory, all that cholesterol is inflammatory, it burrows underneath our arteries and gets inflamed and wears away that endothelium. And what happens is we get a little rupture here. We get a thinned part. You can see on this diagram, the lining is almost worn away to nothing. And then you get a little nick. And then you have maybe like a little burst of pressure, that nick opens up, and then blood and pus start to pour out into the artery. And then we have what's called a thrombus, a myocardial infarction, a heart attack. Okay. And that is how 90% of all heart attacks happen. And so when this happens, because it's such a small, such a small plaque, that's not enough of a blockage to cause chest pain. You'll never have chest pain. You will not know that you have any heart disease. Your first symptom of heart disease will be your heart attack. And of these 90% of heart attacks that happen this way, 10% are fatal immediately. So your first symptom could very well be sudden death. Okay. Sudden cardiac death is what happens. We have like basically a storm of ventricular arrhythmias that causes that sudden death. But,
what percent was that again?
So of the 90% that happened this way from a rupture, 10% are immediately fatal. You won't make it to the ER, because lots of times with heart attacks, we just get storms of electrical arrhythmias, and it's always the ventricular arrhythmias that will kill you immediately. But we are very used to heart attacks in this country. That's kind of all. I used to work at a cardiac specialty hospital. That's all we do is heart attacks day and night. And then after those heart attack survivors come to me and they hang out with me for the next 5 to 7 years. And I try to keep them out of the hospital with their heart failure. But yeah, so you want to prevent the plaque buildup. That's the moral of the story here. And another thing that's really interesting, I want to show you another slide. We talk about heart caths or angiography, like over here on this side, or the dye test, people call it. That's when they go in and they see, do you have a blockage in your arteries? And we call these heart caths the gold standard for telling if you do have a blockage in your arteries. But what the real gold standard is autopsy, okay? And Dr. William Clifford Roberts was a pathologist that did autopsies for 50 years and has done nothing but examine coronary arteries his entire life. And you can look at the heart arteries of someone that's died from a heart attack or someone that just has heart disease but maybe died from another cause. But what they did, there's about, I think they say 11 inches of these coronary arteries, the big ones that lie on the outside of the heart. So in one study, what they did is they got all 11 inches of all the coronary arteries of, like an individual that had died of a heart attack. And they cut them all up into like quarter-inch slices. And these are all the slices, okay? Guess what? There is not one segment of any of the coronary arteries that does not have plaque. Okay. And so William Clifford Roberts is famous for saying isolated coronary disease is a myth. Meaning, like, whenever you look at these angiograms, we're always looking for the bump, for the blockage, right? We're like, oh, that's it. But if you have a steady 10% layer of plaque throughout it's like angiography is just a negative because we put this radio opaque dye down the arteries and that shows up as a contrast. But if you have a smooth blockage the whole length, it's just going to look clear, right? Because there's not going to be a bump. But 90% of heart attacks arise from these very small plaques, not necessarily those. Actually, that one with the clogged pipe with just the tiny pinhole, those are actually fairly stable plaques. Those won't rupture because they're calcified. But it's the smaller plaques that tend to rupture. Because they get that worn away endothelium and they're not typically calcified. So the moral of the story is, let's see. Oh, wait, what's my next slide here? Oh, here we go. Okay. Well, and where does the plaque come from? Guess what? Saturated fat and cholesterol. And so here you can see when you eat Denise and Georgie's food, when you eat a whole food plant-based diet, the serum, that's the clear part of your blood after we draw blood out of your veins, it separates out like this. The serum should be clear. You should be able to read newspaper through the serum. But when we're eating sausage biscuits for breakfast and turkey wraps for lunch and like even a chicken salad for dinner, your cholesterol, your blood is going to be cloudy. So the moral of the story is if you're eating saturated fat in animal products, like the saturated fat, on a T-bone steak, that is always going to be solid. It doesn't liquefy, even if it's, like a really hot day in the 90s, right? So if it's 98.6 degrees and this fat is not going to melt, guess what? At body temperature, that fat is still going to be solidified. It's not going to vanish, right? If it's solid on the kitchen counter, it's going to be solid in your arteries too. And it's going to lay down that layer of sludge. So that's just to say we've got this heart disease our entire lives. It starts at a young age. When should I start worrying about heart disease and switching to a plant-based diet? Yesterday. That's the answer. So this is the food that we want to eat: fruits, grains, legumes, and vegetables. And when we eat the right food, this is one of my favorite quotes, that when diet is wrong, medicine is of no use. We're only treating the symptoms if you're still eating a crappy American diet. But when we treat the cause, which is the food, and we start giving our body the fuel that it needs, we're treating the cause. And then we don't have to do all these meds and procedures, which just treat the symptoms. So that's the end of my story. Take it away. And to be clear, What I'm giving you is general education, but you do need to be under the care of your own personal physician and never, even though I love this quote, never discontinue any medication without a doctor's order. Okay. You need to talk with your doctor before you ever think about throwing any of your pills away. We want to fix the problem first with food. And then as your symptoms get better, then we can slowly and responsibly decrease medication under the direction of your doctor. So that's all I've got. So now
that was fantastic. I mean, that was such valuable knowledge. And, I'd like to just ask, a few comments and questions.
Yeah, absolutely.
Based on that. So, one thing is, I thought it was so valuable when you showed, that one of those last slides with all those angiogram pictures, the idea that it's not isolated. And this is why, because I have had this conversation with a number of people who have had, like, for example, bypass surgery or a stent, but even bypass, like, triple or quadruple. His dad had that a few years ago. They have the bypass and then they come out, and, after they start to heal some, they go, I'm a new man. I'm fine. I'm great. I can do whatever I want. And he just said, I don't think that's true.
No, those grafts can fill up within 6 months. Yeah. Sometimes they have to bypass the bypass. Yeah.
So how do you convince people of that? Because really, I hear this all the time.
You put you're as old as your arteries course in the vegan health bundle. That's all we can do is, but the thing is people are usually not going to get this information. It's just not understood that you can regress plaque with a diet. I mean, I will tell you true. The Medicare program approved what's called intensive cardiac rehab, which was a program promoted by Dr. Dean Ornish. And so Medicare does pay for actually, it's not our kind of whole food, plant-based, no oil diet, but they will give patients a kind of a watered down version and they say, like, aim for predominantly plants, and they let them have like a little bit of canola oil, and they let them have white meat and fish. But that is only about 50% as effective as an Esselstyn diet. But that's what Medicare covers. And so, like, all progress, like, no one is, the American College of Cardiology, American Heart Association, they're not going to be like, oh my gosh, we were so wrong and you are so right, and we're just going to tomorrow we're switching. Like, it only change happens just incrementally. So every time, like, the American College of Cardiology releases new guidelines, they'll kind of relent a little bit, and they keep moving closer and closer. I'm board certified in lifestyle medicine, and they keep moving closer and closer to what the American College of Lifestyle Medicine recommends, like as far as cholesterol levels and things like that. And I have that all in my course spelled out.
Yeah. Another question just similar to that other one. Here's the other thing that people tell me. I'm on a statin. I'm good. I don't need to worry. I eat the standard American diet because I'm on a statin. What would you, I mean, that's not true either, right? But
that's not true. So, and I talk about that in my course as well. And so there's two categories of people. Okay. And this isn't 100% true across the board, but in my estimation, you pick which island you're on. You haven't had a heart attack yet, or you have had a heart attack. Which classification are you? Okay. If you have not had a heart attack yet, a statin is of very little use. A whole food plant-based diet is just scores of like more effective than a statin. A statin is really only effective for someone, because all meds are risk benefit, right? Like, like some meds have terrible side effects, but if you don't take it, you might die, right? I mean, like, I've given meds like that, and we just have to make a choice. But if you are willing to switch to a whole food plant-based diet, that is, like, infinitely more effective at keeping you heart attack proof than a statin is. Okay. The only people that I think would benefit from a statin are people that are like, I will not change my diet and I'm going to get all my food from a gas station. So a statin has a mild anti-inflammatory effect. And we think that's like the only benefit it really gives. So that is kind of what we call absolute risk. Like you're just one person in the world. What is my benefit of getting a statin? However, if you are on the I have already had a heart attack island, the evidence would suggest that you need a statin. And I'm going to talk on Wednesday. I'm on Chef AJ at 2 p.m. Pacific, 4 p.m. Central. And I'm going to talk about cholesterol crystallization and how that happens with heart attacks. Each video that I do, I'm talking about like a different aspect of heart disease. But because of that crystallization factor, which you'll learn about on Wednesday, it is unsafe generally. Like if you've already had a heart attack, you are at high risk of having another heart attack. So statins turn off your liver's ability to make cholesterol. Okay. And so the conventional wisdom is like, oh, we're going to make your liver shut off that cholesterol, but you're still going to eat cholesterol every day because your chicken and your fish and your turkey wraps all have cholesterol. Okay. Your low fat yogurt and milk has cholesterol. Okay. But what we want to do in lifestyle medicine, we want to eliminate dietary cholesterol. We want to cut out all animal products. Okay. But if you've had a heart attack, we're going to cut out all animal products. I'm going to keep my thumb here. And we're also going to turn off your liver's ability to make the cholesterol with a statin. So we're going to get double cholesterol lowering because it is so crucial that we drastically lower your blood cholesterol so we can unsaturate those plaques. I know I have a friend that switched to a whole food plant-based diet after his heart attack, and then he threw out his statins and he had another heart attack. And that I've heard of many people that have done that. I don't know if there's been any studies, but generally almost all plant-based cardiologists recommend if you've had a heart attack that you continue to take that you do need a statin. But we're talking about people that have not had a heart attack yet. Statin will hardly do you any good, especially if you continue to eat junk. You're not decreasing your risk. You are decreasing your risk by 1.2%. That's what it is. Hardly anything. And people think they're like decreasing their risk by like 60% or something. And they just, you have to have proper education, and you have the right to have the proper education when you get prescribed a medication.
Yeah, I could talk to you forever. I'm not going to though, because we don't want to keep everybody and make this video too long. But really, I'm holding back. I just want you to know that because I love talking about this, and I could have so many more questions, so you could help educate more for people. But
I mean, really, it's all in my course, and like $49, you'll get my course. You'll get like an insulin sensitivity course. You'll get a course on bone health, in addition to like 100 recipe books. It's all you just need to eat different food. What do I eat? Will it be boring? No, we've got all these chefs that have made all this food. So yeah, like you just got to find food that you like. Yeah.
Yeah, how delicious. I just got to tell you, we're going to be on Chef AJ tomorrow. So what's in front of us, we actually just did a 2-hour class, and it was going to be the cooking class. Most of it was the science that I shared. But we cooked today. So we decided to cook our dishes, and now they're going to be ready for Chef AJ's show tomorrow. And we're actually going to make a different recipe tomorrow out of all this food that's not in the bundle. We're going to make nachos. But Georgie, why don't you we can kind of just briefly share what's in our bundle, what these dishes are, and then we're going to make something else different out of them just now too.
Okay, this is the basis for Mexican dinner, like tacos, burritos, a bowl if you want to do something like that. We'll start off with air fried potatoes.
Yeah.
Well, maybe I want to just interrupt. I would start off just to give people's head. We want to stuff it with the main stuffings first. Let's just start with that.
Okay.
Because what are you going to stuff your taco?
Okay, main stuffings. I had made a lentil with taco spices and onions. It's lentils. It's delicious. It tastes I can't remember what it tastes like. I had it on the tip of my tongue. But this is replacing your meat. I also have a cauliflower based without lentils. It's cauliflower and spices.
Mushrooms and walnuts.
And walnuts.
Right. So if you're nut free, maybe if you're doing Esselstyn and he's not into the nuts so much like Joel Furman is. You can actually use more mushrooms in this and keep out the walnuts if you're trying to get to that like 10%, low fat diet of Esselstyn.
And then I made some homemade pinto beans. You can see them there at the same time. And I did this all within an hour. And I also made calavasitas, which is squash with some other ingredients, corn, tomatoes. And when I was the standard American diet eater, they made it with cheese. Well, I make this with nutritional yeast. So helps out there, gets rid of that artery clogging stuff. Then, like I was showing you, the air fried potatoes.
Now we eat potatoes all the time. And so when we eat Mexican, we gotta eat potatoes in that as well. Because we just love potatoes.
And then I had made some guacamole here for the topping, and just some shredded romaine and purple cabbage to put on top of it. And then on the tortilla, I actually put cashew cheese, which is in our,
show it to them.
it kind of looks like a real thick mayonnaise after it thickens up. And we use it as a spread. I use it to grill my sandwich bread instead of butter. Just put some of that, and all it is cashews, lemon juice, apple cider vinegar, and miso, and it's delicious.
Oh yeah, that is delicious. Yeah.
And I can't live without this. I always say this is the one condiment I must have in my fridge because, for example, every morning, and we have a video of this on our Happy Vegan Couple YouTube channel, where we hope you guys will subscribe and hit that little notification bell. But you'll see we have the last video we did, I actually cooked. And it was a breakfast video. And at first my breakfast is oat groats with tons of fruit and stuff. And then the next part of my breakfast is a bowl of beans with greens. And this is what I flavor it with, just a little bit of this. And then I also use this as my salad dressing. So there's also a video on our channel that we did not long ago showing you how to make this. So simple in the Vitamix, like 5 minutes.
And it's raw, so it's gonna last a little bit longer than if
Oh
it was
yeah.
cooked in the refrigerator.
So the last thing though, I want to show you that we don't have prepared, like cut up, but our bundle included a dessert. And this is what it looks like. These are brownies made out of sweet potato. And right now it's sitting in our freezer. So that's why it's still in this pan. But when I'm ready to eat it, we're going to cut this tomorrow on Chef AJ. But I cut them up and I keep them in my freezer. And then about 15 minutes before I want to eat one, I take it out. And then it's like very kind of soft and like a little mushy. And it's absolutely unbelievable sweet dessert that's so healthy because it's basically sweet potato, some date syrup, some unsweetened cacao, and peanut butter, and some walnuts. Oh, I mean, 10% low fat, you're not going to eat this. But if you're not doing that, you just want to eat healthy.
Yeah.
This is absolutely delicious.
And if you're
So-
10% low fat, you could do that the powder.
Right,
Yeah.
with the one that's unfatted. Yeah, we haven't used that, but that would be a really good thing to do. So I'm going to just put this back in my freezer so it won't.
So what I'm gonna do real quick is I'm gonna make the mango salsa.
Oh, so let me just share one reason why we're making this.
Oh,
So what we decided to do for this live is make a lentil taco, but then we wanted to do something from Stephanie's bundle. So one of the things that Stephanie included in her bundle was this great guide from the American College of Lifestyle Medicine, where she's certified. Yay, I was excited. And this organization is fantastic. And so I was looking through their guide and I saw this recipe for a salsa that would be wonderful for a taco. So it was a mango salsa, like a mango pico de gallo.
Yeah.
So that's what we're just going to make to also put on our lentil taco. Okay.
Excellent. I love mango pico de gallo.
it's a simple recipe too. There's only 5 ingredients.
Mhm.
I didn't have fresh mango, but I had frozen mango. I just let it thaw out a little bit.
Mhm.
I have red onions and tomatoes. Lime juice. And cilantro, chopped up cilantro.
Mm-mm-mm.
And of course, you can get the ingredient proportions, you know, in the bundle. So.
And did you know, I'll tell you real quick, cilantro is high in nitric oxide, which is one of those compounds that repairs the endothelium. Yeah.
And dilates your vessels, right?
Right. Dilates your arteries. Yep.
Yes, kale.
And kale. Yep. Mm-hmm.
See what that looks like.
Oh, it looks delicious. Yes. Yeah, I just love the mango soul or pico de gallo. Yeah.
Now what I'm gonna do is I'll make a couple of these tacos. One with the lentils and one with the little cauliflower, so I'll give you a little.
Oh, yeah.
bit of video. First thing I'm gonna do, we use corn tortillas are organic, they come from California, they're called Mi Rancho.
Oh, yeah, those are non-GMO, the Mi Rancho,
Organic,
right?
they're
Yeah.
really good. I use their flour tortillas too.
Yeah.
They have a whole wheat flour tortilla. So I'm gonna put these two tortillas in the microwave. For about 15 seconds, just to soften them up. And then
Mhm.
I'll put it on a plate. That. And this is the second time I made these today, so.
Yeah. I tell you, when I first switched over, like that's what I did was just like, if you don't know what to do, just eat Mexican food. It's so easy. Like you've got the beans already. Like we all know what to do. Just don't put the cheese on and get your mango pico de gallo.
That's right.
Mhm.
Now, if anybody wants to watch Georgie make nachos out of all this food tomorrow, we'll be on Chef AJ at 3 o'clock Pacific time.
Oh,
I'm gonna
excellent.
go check that. I think that was right.
Want to put a little bit of cashew cheese on each one.
Mm-mm-mm.
And then I will put these. That.
Yeah, tomorrow,
little
Chef
bit of
AJ
lentils.
live, 3 o'clock
Well-
Pacific time.
The cauliflower on this one.
And you put cashew cheese on there, right?
Yes, I did.
Gotta have that cashew cheese. It's so good.
Go with a little bit of beans on each one. There's double protein here.
Oh yeah.
Some potatoes.
And then after we show you this, I just want to share a little bit of knowledge because that's what I like to do. I want to talk to you guys just a little bit about whole grains and fiber. Well, it'll be pretty quick, but I find a lot of people when they're eating their grains, they kind of just stick with rice. And if you're whole food plant-based, of course, you're going to do brown rice, not white rice, or wild rice, some other form. But I found that a lot of the other whole grains are actually have a lot more nutrition than just the brown rice. And that's what I want to show you because we often use we hardly ever use brown rice anymore since I realized that. And, you know, I believe in maximizing nutrition. That's what Dr. Michael Greger of nutritionfacts.org has taught us. It's like when you eat, maximize your nourishment, right? Because it's all for your body. So like, you know, when you were talking a little bit a moment ago about the green,
Let's go ahead and see if we can see what I put
Oh,
together.
it looks delicious. I'm hungry. Oh yes. That looks amazing.
All no oil.
Yep. It's gonna be nice and crunchy from like the cabbage and all that. Oh yeah, it'll be delicious.
Okay.
Yeah.
Well.
Yeah. So
And then I made the calavasitas and we just eat that on the side. And
Right.
it's just squash and corn,
Mm-hmm.
like I said, nutritional yeast and a bunch of seasonings.
So there's so many ways you can serve this, you know, like today we did the mango salsa, you know, earlier you could have we did it a different way. Tomorrow we'll make nachos. I mean, you know, this is such wonderful food. I like to do a bowl often, actually, you know, just take a bowl like this and just
Mhm.
put in all of this. And one of the reasons I like eating it out of a bowl is because I really like to maximize my vegetables, you know, and in a bowl, I can get a lot more vegetables in than like a little taco, you know.
Mhm.
I can have like a whole nice mixture of different greens, like, you know, some romaine, collard greens, kale, because often we have all that in our fridge in different containers, you know, and then you can load it up.
Yeah, perfect.
If you use these ingredients to make a burrito out of them, you can make the burrito in the morning and pack it up and take it on a hike. And
Right.
like this, when you're on a hike, this is delicious, even if it's cold. Doesn't even have to be warmed up. Another thing that I like to do when we go hiking is I like to cook potatoes in the microwave or steam them the night before, put them in the refrigerator, get them cold and take them on the hike. When you eat a nice cold cooked potato on a hike, that's great too. You know, it's just like eating an apple to me. I love potatoes.
I know, we do too. I love potatoes. I don't know
Yeah,
why.
that's the funnest thing. You don't have to feel bad about eating potatoes on a whole food plant-based diet. Yeah.
Right, as long as you don't load them up with that oil or the sour
Right.
cream. So I'm gonna have Georgie, just wait for a moment. I'm gonna have him hold up something on the screen as I just share this little bit of knowledge with you to encourage you guys to eat other grains, whole grains, than rice. Okay, so this is what I want to tell you. What I'm going to show you is the amount of fiber and protein in brown rice versus these other grains. And what you're going to see is these other grains are significantly more nutritious in the protein and fiber than just the rice. So it's the same serving size. It's all like a quarter cup dry before you cook it. So we're, doing apples to apples. Okay, so the first one, Georgie, is the brown rice with the wild rice. So on that, you can see if you were eating short grain brown rice, you get 3 grams fiber, 3 grams protein. But if you compare that to wild rice, you can see you at least get more protein, significantly more protein. The fiber is the same. So right there, the wild rice, offers something. Now, the quinoa one is the one, oh, did we miss the quinoa? Where is
No,
it?
it was there.
I forgot to say the quinoa.
It was on the bottom.
So the quinoa is also better than the brown rice. It's got 1 more gram of fiber and 2 more grams of protein. So you see that. So quinoa is, and we always hear about, quinoa is a high protein grain. Well, there you go. It's got more protein than the rice. So, it's another reason you might want to enjoy that. And also quinoa cooks, fast on the stove. Now, all the next ones we're going to show are all the same with the fiber and protein. Still way better than the brown rice. You want to hold the one up with the wheat berries, the oat groats. That's the ones with all of them. So, you see on one side the brown rice, and then on the other side, you see whole wheat berries and buckwheat groats, and then you see whole oat groats is what we eat every morning, and you see pearled farro. And they also still all have 2 more grams of fiber than the rice, and they all have 3 more grams of protein than the rice. So again, why not eat those grains, right? Now,
What I'm amazed at is that all those farro and the wild rice is more protein than quinoa. Like I thought quinoa was the highest protein grain, but those other ones are.
But I took this off the packages, or I can't remember if I went to Chronometer, but no, I probably looked at the package. So this is the gold standard, the one right now. And this is what I like to eat the most of, whole barley. Not whole barley, but whole barley, or they call it hullis. And look at that, fiber, 8 compared to 3 of the rice, and 6 of the protein compared to 3 of the rice. And let me show you what that looks like. And some of you might not even know what all these grains actually look very much like rice. So we buy these at a store called Natural Grocers, they may not flour, but just kind of looks like rice, but you get more nutrition. So I just wanted to share that this is what I like to do. I follow all these doctors, I listen to all these lectures, and read the books, and then I share this knowledge with people to maximize their nutrition, So again, because we always want to, we call ourselves a happy vegan couple, and that's because of our ethic. I actually was a vegetarian when I was 21, and that was because of the animals, and I kept that up until age 60. When I watched Forks Over Knives, the very next day, I gave up my dairy because I learned from Dr. T. Cullen Campbell that the protein in dairy is a cancer promoter, and I don't want cancer if I can avoid it. So I literally, the next day, I gave up the dairy, and I was whole food plant-based 100% ever since then, like about 12 years ago.
Real quick about me. I became vegan 10 years ago, April 25th, 2014. I called Denise and said, I'm now a vegan. And she said, okay, well, we'll see. And it's only because she had been talking to me about the way she ate. And
It worked.
It worked, to be honest with you. I was having feelings for her, so I figured, okay, I better become vegan
There you
for
go.
her. But then I became vegan for everything else. But it was for love. That's why
It was to get the girl.
exactly, and it was a good choice. I mean, I'm much healthier than I was back then. I'm 68. I'll be 69 pretty soon. So
Well,
Feel
you
free
guys
to-
both look amazing. Yeah. I
So
would
part of
love
the
that.
thing for him was that in his former marriage, why don't you just quickly just say what happened?
well, my wife had a disease called Charcot-Marie tooth disease. It's a type of muscular dystrophy. She was 58 when she passed away. Went from being healthy to a walker or a cane to a walker to a wheelchair to being bedbound for 16 years. And I was her caregiver
Oh
for
my
16
goodness.
years. And if I would have known the way I eat now versus then, she might have lived little bit longer because her main diet was like chicken and cheese
Mm.
And
quesadillas
sugar.
and sugar. She would put 10 tablespoons of sugar in a 16-ounce glass of tea.
Talk about inflammation,
You know,
right,
so-
Stephanie?
Mhm.
It was,
Yeah.
like I said, I was her caregiver, but I wish I would have known what I
Yeah, and
knew.
that's the thing is most people, I mean, like that was kind of before we had all this internet stuff going on, but most
Right.
people just they don't like I used to think that cheese and dairy was healthy because that's what everyone tells you, and it tastes good. So you're like, shoot, yeah, it seems right. It just feels right. And you just have to get, that's why I do what I do. Like people just have to get some education, like what we learned from Forks Over Knives to realize it's not healthy. Like humans evolved over millions of years, hundreds of thousands of years, not eating dairy, not eating cheese. We evolved in an environment of scarcity. In fact, cholesterol was almost absent from our diet. So our bodies evolved to hold on to cholesterol whenever we get it and like sock it away. But now it's all around us. And that's the problem is that our bodies we still have these Paleolithic bodies, but our food system has just changed so rapidly, especially in the last 50 years. Our bodies are just shell shocked and they're still trying to hold on to all the fat and help us out, but we don't need any help. We have too much fat. It just, our bodies don't realize that our food environment has completely changed. So, yeah.
How many millions of years has man been on this planet?
Yeah.
And then all of a sudden in 50 years, we're eating a totally different diet.
Right.
So just, I guess one of my parting thoughts, for anybody who might be watching this, either in bundle week or now bundle week. And of course, bundle week, get that bundle, get her
Mhm.
course, and you can see our thing too. But anyone out there, you have people in your life, I'm sure. Well, we all know we all have heart disease, right? Stephanie showed that. So we're all vulnerable. And all these other diseases, type 2 diabetes that she's also got all this knowledge about, all these diseases, so many of them can be helped if you really believe in the power of plants. And that's why, we do what we do because we really believe in it. We've listened to the evidence, we've read about it, we've seen it. And we just know as we get older, we're up there. We don't want to suffer if we don't have to, and there's so many people suffering. So our message is, pay attention, listen, learn, research yourself and recognize, just don't listen to your doctor tell you, you have to live with this. You have to experience the pain. You have to have disability. Just don't accept that, first look. Explore this way of eating. Look at all the testimonials that are out there from all the sources. She's got so much in her bundle contribution that you will learn from. Don't accept that. Know that you have power with the power.
You want to avoid the nursing home. Yes.
That's it.
All right. And to buy the bundle, you can look in the show notes below the video, and that's where the link will be where you can click and get the bundle. But yeah, well, I sure appreciate y'all coming on, Denise and Georgie. It was so good to meet you. And I wish you well and thank you for like all the education and the work you do and your delicious Mexican food. And yeah, everyone, get the bundle. It'll change your life. It's $49 and you have it for a lifetime. So you'll have
And
tons of
subscribe to
information.
Happy Vegan Couple on YouTube, and we're on Facebook too. That's all.
Excellent. All right. And yeah, you can follow me on YouTube, Facebook and Instagram, and all my links are in the show notes. So thanks, y'all. I sure appreciate it. And I wish everyone peace, love, and plants. Take care, everyone.
Bye.
Bye-bye.